Empowerment Network or on YouTube. Now, we want to thank African Women Development Fund, Global Fund for Women, DKT International, Women First Digital, Cross River State Ministry of Health, UNFPA, Movements for Women Alliance, and the Cross River State Primary Healthcare Development Agency. We are grateful to all these partners who help us sponsor this work and ensure that this valuable information is being passed week in, week out. Now, today, we're talking about a topic which we started last week, which is bacterial vaginosis. Now, we had an amazing session last week, and this week we have an even more insightful speaker. Our speaker for today is Yvonne Ewobohan. I really hope I called your name properly, fam. Just forgive me if I murdered it.
Hello, now, Fred, can you kindly open your camera as we continue? Thank you.
All right. Is that fine?
And again, it's like, yeah, it's like the speaker is out.
You said?
Continue.
All right. Sorry about my voice today. The weather is really mixing here, so it's giving me issues, right? All right. So as I was saying, our speaker for today is Yvonne Ewobohan. She's a graduate of Madonna University. She's passionate about drug manufacturing and is also a public health enthusiast. Yvonne has a strong focus on promoting access to essential medicines and quality healthcare. She has been actively involved in several advocacy and awareness campaigns aimed at promoting health for all. She's a member of the Pharmaceutical Society of Nigeria, Pharmaceutical Society of Nigeria, Young Pharmacy Group, Lagos, where she's actively involved in several advocacy and awareness campaigns that aimed at promoting health for all. Through this campaign, she has impacted over 100 people on issues pertaining to human health. She's currently working as a pharmacist at Afro Health Pharmacy, where she's committed to making positive impact on life and serving the community. So welcome, fam. We're so glad to have you today on our call. Hi, fam. Can you hear me?
Yes, I can hear you.
All right. Thank you so much. All right. So we'll be doing a short recap from last week, right? And the recap is basically what is bacterial vaginosis. It was a very nice session, so we learned. But one thing I know, over weeks, over months, or almost a year of hosting this program is that we get to learn more. Some things that were not said in the previous session may be said today, which is why even though you were anyone of our live session last week, it is very important that you listen in carefully this week as well, because there's so much you learn. All right, now, last week we learned that bacterial vaginosis is an infection or a bacterial infection in the vagina. And based on what the last speaker said, she said this same bacteria is normal flora or is okay in certain parts of the body. When it comes out to the vagina, it becomes a problem. Then we also learned that it is common among women and girls, not so much in girls that are not of puberty age, but from 15 years and above, it's usually common among them. So today we are going to go ahead to learn more about bacterial vaginosis, which we label BV, right? Now we're going to go to our first question. Are you ready for us? All right, Esther, please move to our question slides for today. All right, so Ma, fam, can you hear me?
Yes, I can hear you.
All right, so can I ask my questions now, Ma?
Okay, go ahead. Am I visible?
Yes, Ma, you are. I can see your beautiful pharmacy. It looks like you are in a pharmacy of sorts.
Yes, I am at work.
Awesome, Ma. Okay, so please, we're going to go to our first question now for today. Our first question is this. It says, are there any specific risk factors or behaviors that young women and girls should be aware of that may increase their chances of developing bacterial vaginosis. So what I would really love you to do for me now is that in, let's say, 30 seconds to 1 minute, just again help us state what bacterial vaginosis is. Then you help us answer the question we have on the screen. That are there any specific risk factors or behaviors that young women and girls should be aware of that may increase their chances of developing this disease?
Okay, thank you for, all right. Thank you for having me, and I apologize once again.
No problem, it's our pleasure. We are grateful to have you here.
Network here has been really horrible. Like we know, bacterial vaginosis is a polybacterial infection. Did you say something?
No, ma, you
Okay,
can go ahead.
Bacterial vaginosis is a polybacterial infection, and what that means is that it's not just one bacteria that causes it. It's a lot of bacteria, and a lot of bacteria causes it. So it's the overexpression, in simpler terms, the good bacteria. And like we should know by now, the bacteria has, the vagina has different bacteria, which we call the microbiota, the normal flora. So there's the predominant one, which is the lactobacillus, right? So that is the one that is useful, that helps the vagina in self-cleansing property and all that. So when this lactobacillus is reduced, it now causes some other non-helpful bacteria to increase, thereby causing this bacterial vaginosis that we know of. So certain things can increase or certain things can reduce this lactobacillus, and it could be smoking cigarettes. It could be having multiple sexual partners or a new sexual partner. It could also be douche to you insert the person the vagina of some sorts and other women. So smoking in particular is because smoking generally
No, I didn't actually say anything.
the white blood cells in our body.
Wow.
So when that is reduced, it also increases the chances of infection. Should I continue?
Yes, ma'am, please continue.
Okay, so those are the risk factors for the bacterial vaginosis.
All right, so you mean that these things you mentioned, like smoking, having multiple sexual partners, or how do you call it now, lesbianism, can increase the chances of the person or a girl or a woman having bacterial vaginosis?
Yes, and also the use of intrauterine devices, those are the IUDs. Basically anything that causes the pH of the vagina to increase more than 4.5. So 4.5 is the normal pH. So anything that causes it to increase would also increase the risk of BV.
Right. All right, great. Thank you so much. All right, now to another question. What are the potential complications or health risks associated with untreated bacterial vaginosis for young women and girls? Now, how I would love you to answer this question. Oh, I think we lost her there. But before she comes back on, let's just talk about what she said. So many a times I've seen young ladies smoke, mostly in the southern part of the country, right? And if they feel like, if guys can do it, women too can do it. I think this is one of the places where we draw a line as women. It's not what a man can do, a man can do better, because this exposes us to health risks that may cause infections. And based on what we learned last week, it's not like bacterial vaginosis can impede your fertility. It's just that if the area around the vagina is not acidic enough and is not able to cleanse and protect, you are open and vulnerable to lots of diseases. And these diseases are so horrible. We heard that in the symptoms last week. We learned that the symptoms are that it has fishy smell, right? Bacterial vaginosis has fishy smell, which and then there's itching, which will make just disgrace you outside or embarrass you rather. So it's better that we stay healthy and stay conscious of this. All right, Esther, is it possible to get our speaker back on?
Yeah, she will join back. Maybe it's network from our end.
Yeah, her network is really, really challenging her. All right, so if you have any questions for us, those watching on Facebook or YouTube, do well to drop your questions in the chat box and it will be sent here for us to answer. If you have an opportunity to join the Zoom session directly, you can also drop your questions in the chat box and we'll take it as soon as we can. Now, but the next question, I feel like she's really going to love this question. Although, does anyone here want to throw light on this question now? What are the potential complications or health risks associated with untreated bacterial vaginosis for young men and girls? Now, I know you may not speak from a professional standpoint, but based on what you have learned in the past session and this session now, about what bacterial vaginosis is and what can make a lady become prone to that problem. What do you think are potential complications or health risks that may be associated with bacterial vaginosis? Anyone wants to talk, just raise your hand and I'll call you. Okay, all right. So while we get our speaker to come online, our network is really, really challenging her right now. But I can say from my own end, right, that so potential complications or health risks that could be associated with untreated bacterial vaginosis would be
Hello, am I back on?
yes, awesome. You're back on now. We can hear you. All right, thank you, fam. Welcome back.
Wow, I'm so sorry. I got cut off with the network.
Yeah, all right. Thank you so much for joining back. All right, so we have a next question. Our next question now is, what are the potential complications or health risks associated with untreated bacterial vaginosis for young women and girls?
Okay, so this Okay, so this now I'll divide it into two. The potential risk if untreated, generally BV on its own is not an issue if you treat it, and it's very easily treated. Can you hear me?
Yes, I can hear you.
Okay, so the BV it's not exactly harmful, but if you leave it untreated for long, young ladies could have things like okay, I'm sorry, this is not a good one. So if you leave this BV untreated, that's first off, I will just talk about the treatment. So the treatment is usually orally or intravaginally, right? Through creams or tablets. So in certain cases where people don't want to take their medicine or want to take the medicine that their great grandmother used or one agbo like that, I'm not dissing agbo, but it happens. We see a lot of things in practice. So if such people leave these things now, it can increase the susceptibility to STIs. Now, it's very important to note that BV is not a sexually transmitted infection, but it can cause the susceptibility of contracting these STIs. So things like chlamydia, HIV, gonorrhea, human papilloma virus, herpes simplex. So stuff like that. And for women that are pregnant, the loss of the baby, it could lead to postpartum endometritis. Can you hear me?
Yeah,
Well,
just take that. Yeah, please just repeat the last line again. Thank you.
Okay, so I said for pregnant women, it could cause spontaneous abortion. That's just like normal miscarriages. It could also cause postpartum endometritis. This endometritis is when the inner lining of the uterus is inflamed and it causes discomfort, fever, hay fever, so many other things. While for people that are trying to get pregnant, those are going through in vitro fertilization process, it could lead to low success rates of implantation. And it could also, in the case of if the person does get pregnant, it could now also cause early loss of pregnancy, right? So this BV, just basically, once you notice that fishy odor, once you notice the thin grayish white discharge, and just immediately the lady should go to the doctor at once.
All right. So now, you have mentioned the fact that it could lead to endometriosis, right? Now our next question for you
Yes.
is, you have talked about some of the treatment. You said in vitro treatment, right? Or oral tablets. Now, we want to know, since you've mentioned that already, you're going to skip that. These are the treatment options you said. But now, are there any age-specific considerations or recommendations for treatment? Just, we have teenagers and we have women, right? So maybe a teenager has it or a woman has it, and then maybe a woman from the age of 50, which is a menopausal woman now, have that issue. Are there any age-specific considerations? Taking this three class of women, girls just getting to puberty, women of childbearing age, and then those who are now in menopause age. So, are there any age-specific considerations? Does the treatment differ based on age and the state of their body?
So usually when we treat certain things, like when we treat things like this, we ask certain questions. So it's important to know that this bacterial vaginosis is more prevalent in ladies that are sexually active. That's why a child very, very unusual would get it. So in the case of teenagers now, usually teenagers have either reduced treatment according to their age. So because treatment is through antibiotics, right? The main one is metronidazole. It could be 500 milligram metronidazole or a gel. We usually treat it through oral tablets and creams, so vaginal creams. So the weights would calculate it based on weight, so especially for teenagers. Then for elderly people too, we take in certain considerations. But for any age specific considerations or recommendation, there is none, just the general the weight per kilogram of the individual.
All right.
Right. So and of course counseling, because, and like I said earlier, anything that increases the pH of the vagina is what can cause it. So we would, in addition to medical intervention, we also give them counseling for certain lifestyle changes.
Okay, like,
You mean the
example
lifestyle
of
change?
Yeah.
Okay, first off, I would recommend that, rather it's guidelines that I recommend, because I'm not the one that puts it. So we're following set down proven guidelines. So guidelines would recommend that these ladies have to reduce the amount of sexual partners for those with multiple sexual partners, avoid douching, don't share sex toys for those that indulge in the use of sex toys. Also reduce the use of antibiotics, of antibiotics without use. So there are some cases where people just could have like a common flu and just take antibiotics, could have this take antibiotics. Discriminate use of antibiotics could also reduce lactobacillus and increase the other harmful bacteria. So such things, we counsel them on proper use of antibiotics, and of course, go to your pharmacist or your doctor before you take certain medications. So that douching as well. It's important to know that the vagina is self-cleansing, so you do not need to use soaps, you don't need to use those douches, you don't need to pour water into targeted areas with a hose or any crazy thing like that. Just wash normally with water, and sometimes you could pat to dry, sometimes you could leave to air dry. So things like that, just little lifestyle changes would make the person's vagina go back to normal.
All right, amazing. Thank you so much for that answer. Okay, so our next question now that we have is this. Can bacterial vaginosis affect menstrual cycles or fertility in young women and girls?
Yes and no, in the sense that BV on its own, like I mentioned earlier, is not harmful and is easily treated. Now, when it's left untreated is when the problem comes, because leaving BV untreated leads to more morbidity, that's more diseases. So inadvertently, it could increase the risk of fertility issues. Like I mentioned earlier with the IVF implantation, reduced level of IVF, postpartum endometriosis, also pelvic inflammation, because all these things, once the pH of the bacteria is increased, other little diseases that have just been waiting to be expressed, waiting to gain entry, will suddenly swoosh in. It's like they close the door on them. So that increased pH has opened the door. Hence, they are just rushing in. Because, 4.5 and below is really acidic, and it's not every bacteria that can survive in such. So increasing it is making it more alkaline. Hence, also, so if left untreated, bacterial vaginosis can affect fertility. And as for menstrual cycle, it doesn't really affect it. The lady might still be seeing her menses as usual, but there might be complications due to the side effects of leaving this BV untreated.
All right, thank you so much. Okay, so we understand that it's not as deadly as I would have thought when I saw the vaginosis and bacteria joined together. Thank you so much for that. Okay, now we'll go to our next question, which would actually be our last question before we see if we have any questions in our inboxes. Now, our question here says, are there any lifestyle changes or hygiene practices that young women and girls can adopt to prevent bacterial vaginosis? I believe you've mentioned some of it. Please just help us highlight more on it.
Okay, so BV generally is uncomplicated. You just need to do a few things and adjust a few things. Like I mentioned earlier, avoid douching, avoid washing with soap, your intimate areas with soap, and even the so-called intimate wash. Avoid those. You just need water to wash your vagina, okay? So all the soaps, trash it. And secondly, reduce sexual partners, practice safer sex with the use of condoms, of course. If you must practice, then that is also very important, because it doesn't just prevent bacterial vaginosis, it also prevents other sexually transmitted infections. So safer sex is number 2 on the list, or it could be number 1. And as well as reduce the indiscriminate use of antibiotics. It's not every common flu, every catarrh, every back pain that somebody goes to go and buy Ampiclox. Because sometimes what I see here, fam, please cut me 1 Ampiclox. Fam, I want Ampiclox to flush my system. So all those practices, as long as you're watching this, you should stop it. Stop all such practices. And use antibiotics only when prescribed by your doctor and pharmacist. And please finish the dose. So also personal hygiene, like getting rid of wet clothes. That's for those that are physically active, they exercise, they work out a lot. So immediately you come back, you you put away your wet clothes and go have a shower. So small practices like this can really go a long way.
Right. All
Oh,
right.
and another
Amazing.
thing, when
Okay.
when the person does in fact do contact BV, it's important to not ask your neighbor that medicine she took when she was having that infection, because unfortunately this BV is what people term infection a lot, right? So keep those that go away. Don't take your sister, friend, or whatever's medicine and just go straight to seek medical treatment. The earlier the better. So that's it.
Yeah, amazing. Thank you so much for that. Because I feel like in Nigeria here, we have this referral kind of medicine that we practice. Every mother will refer the medicine her child use and stuff like that. So I totally agree with that. And it's an amazing work you pharmacists do. But I've been able to
Yeah.
endure all our crazy questions and our like, are you in my body? Do you know what I'm feeling? I'm feeling what I'm feeling, stuff like that. So it's an amazing work you guys do. And we are going to say we are so grateful because week in, week out, we have so many pharmacists and doctors. You know, you have to learn a lot to be able to stand in those shoes. Then many times we come with
Yeah.
our roadside medicine, right? Our roadside clinic medicine, and they're like, do you know what I'm going through? So thank you all. Thank you so much for that. So but someone dropped a question. She was asking that she wants you to clarify that did she hear that one of the causes of this ailment of bacterial vaginosis is lesbianism? So I think I was the one that used that word lesbianism. I think I was one that used that word like lesbianism,
Yeah.
but
You did.
can you just like you said same sex, like a female and a female, right?
Yeah, I did mention women that have female partners, which of shared, they can. So such practice BV. So it's as simple as that.
All right. So to recap what Pam sister said, when a woman has other female sexual partners, she could increase her chances of having BV. She didn't say it causes BV. She just said it could increase her chances of contracting the disease. And then, as we have all learned today, it's
Yes.
not like going to kill the person the next day. It's not on the cancer rating of diseases, but it's something we as females should be mindful of. Did I get that right, Pam?
Yeah, it's something females should be mindful of, exactly.
Thank you so much. Thank you so much. We are grateful for your time. We noticed that you are really busy and you have to get back to work. So we'll let you go at this point. We hope to host you at another time, maybe a time that is more convenient for you so we can talk at length. Also, sorry,
Okay.
let me just ask this last question, just so the listener is really satisfied, right? So she says, is BV contagious?
No, BV is not contagious. It is not an STI. Generally, what we classify STI as is any infection that is due to exogenous or an outside bacteria, to simply say. So since BV is caused by a bacteria that is naturally occurring in the body, it's not an STI, hence it's not contagious. So but when something affects, that is when the person can get. No, it doesn't do that.
All right, thank you so much, fam. That's all the questions we have for today. Ma'am Yvonne, can you please mention your surname so that I don't do damage again?
I heard you the first time. It's Yvonne Ewoy Bokan.
Okay.
Yeah.
You are from Edo State, right, fam?
Yes, I am. And I know
I'm
my Edo brothers and sisters who say that's not how to pronounce it, but
Oh,
that is
seriously?
what I have.
So they actually won't shoot me when they hear me. That's fine. That's fine. I'm safe then. Thank you so much. We are grateful that you came on board,
You're
even though
welcome.
you're
Thanks for having me. And I'm sorry once
yeah,
again
thank
for
you
the
for
whole
having me.
network glitch.
No problem. Nigeria is showing everybody what
Yeah.
is showing us. So but we are still fine. God's helping us. So thank you so much. Our people very much will be in contact with you in your DM for any other time with the chance to avail yourself and just help us with your time and explain something to us.
Okay. Thank you so
Thank
much.
you. Thank
See
you,
you
Mama. Thank
again.
you, Mama. Yeah, see you. Bye. Thank you all so much for joining our session today. We are grateful. Thank you, Ma, for the questions you shared, you asked us. We can see you, but we actually don't know your name. I think it's just your phone that is showing there. So, but we are grateful for joining us. Thanks to everyone watching online on Facebook, on YouTube, and to those that will watch after this time, for those who watch replays, we are really grateful for your support. You watching it shows us that we are doing well and that our content is valuable to you. If you have any questions, any topics you would like us to address, we would love you to drop it on the chat box, in the chat box on either YouTube or Facebook, or you can go to our website at www.africangirlsempowermentnetwork.org and just drop your questions there. We would reply those questions and we would have sessions like this and discuss those topics to the full extent. Thank you so much all for joining. As we go today, we want to say thank you to our partners that keep helping us make this show keep going, that keeps the show going. We are grateful to all of them. Also, Bella by Choice has live walk-in sessions or walk-in centers across Calabar where you can go to have a one-on-one meet up with any of our health counselors, our health experts, and they will give you information that you need. Thank you and see you next Thursday. Bye.